Dr. Rebecca Mwakichako. I'm a general practitioner. I work in Kenya at the Moi County Referral Hospital, Taita Taveta County, Voi. And I work at the Cancer Center, where we basically take care of oncology patients. But we have taken an integrative approach where we also see hemophilia and sickle cell patients. So the center is about 8 months old now. We established it last year in October, and it was established through a collaborative partnership of county government, the County First Ladies Association, International Cancer Institute, Roche, Women for Cancer, and other like-minded partners. And the essence of this partnership was actually to provide very affordable, accessible, yet quality cancer care for the people of Taita Taveta County. So before we established this center, we realized that a number of our patients had to travel for a very long distance, either to Mombasa, to Eldoret, to Nairobi, for cancer care, because these are basically the places where they could access public facility for oncology care. So when we established this center, a number of things were coming out. One is that we had a big number of oncology patients who needed these services in the county. And we even got to realize that a number of these patients were at home, having had the diagnosis and even the staging, but they could not just transition to these specialized centers where they were to receive care. One, the cost was prohibitive, but even other things that were coming up was because they did not have a person to walk them through the journey of cancer care and what they were expected to go through. A number of them were extremely afraid and very anxious about that whole journey, so they really did not take it after all. But when the center was established, they were extremely excited. It was an exciting time for the people of Taita Taveta, the doctors, and most importantly, the patients, because now they were able to access these services right from home. Right now, we take care of about 70 patients, and we have about 20 of them on chemotherapy. We've referred a number of them to radiotherapy services that we currently don't offer in the region. That's not only Taita Taveta, but the coast region in totality. We really don't have radiotherapy services. But one of the most beautiful things is to see patients get treatment from home, be brought by their relatives, go through chemotherapy together with their relatives, have a chat, as opposed to when they had to travel for very long. And if you talk to some of the doctors who are in these specialized services, they would actually tell you that some of these patients would sleep in their casualties for 3 weeks as they were now awaiting their next sessions of chemotherapy. So when we started the center, as I said, it was extremely exciting, and even for the doctors. But the truth is a number of the healthcare providers had not had interaction with oncology patients in terms of care, starting them from diagnosis to staging, now to managing them. You find that a number of them did not have this experience. But as we were interacting with our partners, different partners came in to support in different ways. But we had International Cancer Institute coming in to support, especially in matters capacity building and training healthcare providers in managing these patients and giving their expertise in the field. And they would send a team of oncologists, nurses, pharmacists all the way from Eldoret and from all over the country. And then they would come to the clinic, and then we would see patients together. And one of the things that was happening during this time, apart from just general consultation and initiation of chemotherapy and referral of these patients, was a lot of on-job training was happening for us as medical officers, and even very importantly for the pharmacists, who are now learning to compound chemo and administer it in a very safe manner for the very first time. So between these weeks and the 3 weeks when they were coming, there were a lot of consultations, over the phone consultations, a lot of video calls, WhatsApp chats, and we also had to present in a multidisciplinary tumor board that was really virtual. And when we looked at it, we realized that the establishment of a proper telemedicine center in the county was now not, it's something that we could not ignore. So at that time, ICI was running a pilot for telemedicine platforms for counties, and they chose our county to be one of the counties then that would participate in the pilot. And during that time, we were trained on Join. And this platform really was to afford us the sophistication of even sending very high resolution images to just discuss with consultants all over the country, and in some instances consultants outside the country. So when we look at it really, our clinic was built on the foundation of telemedicine. Because right now we have an oncologist, but before then we really did not have an oncologist, but we were able to offer very quality care for these patients, and it was really, most of the time it was remotely. But now we are extremely excited to incorporate Join and to have a number of us, including myself, trained on the platform. And now looking at the future, we are even extremely excited because we know that once we are able to even have a histopathology lab, because right now we don't have a histopathology lab, we send our samples to Eldoret where ICI processes the tissue for our patients for free. When we will now have a histopathology lab, we should be able to then even use telemedicine in consultation between pathologists. Because right now they have an exciting platform where they can be able to even read these slides remotely and then offer very quick diagnosis to the patients. What I would like to share with other counties or other places in the world, and especially in sub-Saharan Africa, where these specialists are still very few, is that indeed you can start these oncology centers anywhere in the world, despite the fact that you might not have oncologists on board. And this is because you can be able to benefit from a pool of very intelligent, very smart consultants, but from other countries and other areas through telemedicine. So if our center really could start and could be built on the foundation of telemedicine to a place where now we have an oncologist and we can be able to now review our patients, really any other place can start. So one of the things I have come to realize as a general practitioner working with oncology patients is that this service is really needed, and you find that a number of our patients who have very good prognosis are at home and they cannot just access this care. But when we confidently go out there and start these services for them, then even the outcome of these patients becomes extremely, extremely good. You find out that even apart from just diagnosis and teleconsultation, we are able to appropriately refer patients to care, even to radiotherapy centers through telemedicine. Because you see, it's not enough to just tell a patient, go to Nairobi or go to Mombasa and access care. Who are you going to? Which consultant are you going to see? Which service are you going to have? How will that journey look like for you? And you find that when you are able to transition these patients, and even some of these consultants know ahead of time the patients that they are anticipating to get. Next week we are transitioning a patient to go and get targeted therapy in Eldoret, and you find that we already had this conversation about this patient. So this patient is very confident that they are just not going to Eldoret, but they know where they are going to go and who they are going to see and what their treatment looks like. So I tend to really believe that the future is telemedicine, and I hope that all healthcare providers can embrace this very exciting platform. Yeah.